We must put people first if we are ever to end the HIV pandemic as a threat to public health. That's what person-centered care is all about. Almost 1,000 stakeholders across the globe have been directly engaged through the program so far. We are seeing the real impacts a person-centered approach can make.
Across the southern United States, healthcare becomes about, well, what are the provider's needs? As opposed to, what does that individual need? That might be housing, that might be food. Well, I care less about medication. If I haven't ate in 2 days.
Here in Livingstone, Zambia's tourist city, which is also the huge transit city with a lot of people affected by HIV. We saw the primary health services getting congested. So now we have key population members who've been trained as community health workers that are actively participating in the delivering of services in a peer-to-peer approach. And this has really helped to bring down stigma and discrimination, removing the fear of being criminalized, and decentralizing these services has also helped to decongest the facilities.
Individuals living with HIV who are on treatment can now live healthier and longer lives. The challenge is that we know 40% of people living with HIV will disengage at some point in their HIV care treatment. I hope that we can close the last mile. Person-centered care is at the core of this.
Person-centered care, when done right, they're led by individuals in the community. As a person living with HIV, I understand the need for community and the need to serve the community. The research project that I'm doing with IAS through the grant is focused on validating the measure for quality of life for Black same-gender loving men. With this person-centered care measurement that providers can use in HIV care, you take the time to really get to know the individuals that you're speaking with. You make them feel involved, and by ensuring their needs are met, they're going to continue to come back.
The seed grant awarded through IAS PCC program started with training data collectors from the key population community to collect data from the recipients of care. We also conducted focus group discussions with female sex workers and interviews with the community health workers. The research is going to influence policy change in terms of how these peer-led services are going to be provided in the community.
We really want to focus on policy and making these systemic changes to ensure these systems include us. And if they don't include us, kick down that door and make sure your passion drives you forward.
Person-centered care is not optional. It is essential. Look at person-centered care as an investment as well as a human right that is going to support ending the HIV epidemic.